Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco.
I'm going to talk about postpartum mommy concerns, as I do see a lot of mothers after pregnancy coming to see me for various issues and complaints. Mothers undergo a lot of physiological and physical changes during the first, second, third trimester until post-delivery, breastfeeding, and so on. So there are a lot of issues and a lot of changes. For example, breasts. Mummies will often experience enlargement, expansion in breast volume during pregnancy, all the way throughout their breastfeeding period until the end of breastfeeding. The expansion of breast volume during breastfeeding and the subsequent reduction in atrophy when they stop breastfeeding leads to stretch marks, shrinkage, loose skin, and breast atrophy. Mothers usually gain weight during pregnancy, and many find that they could not return to their pre-pregnancy weight after delivery. So the changes during pregnancy and post-pregnancy that most mothers will notice are, first of all, weight gain. Most mothers find that they have increased appetite and increased calorie intake during pregnancy. So after pregnancy, many of them could not return to their pre-pregnancy weight. And the additional weight gain will tend to be reflected on thickened fat layers around their arms, tummy, waist, and such. And that causes a great distress to those who try very hard to return to their pre-pregnancy shape and weight. There are loose skin that's involved as well. During pregnancy, there's an expansion in volume and surface area on the breast and the tummy. So when pregnancy is completed, or when breastfeeding is completed, the tummy size and the breast size shrinks tremendously. And that leads to stretch marks, loose skin, skin atrophy, and such. The next is, during pregnancy, the abdomen experiences tremendous expansion. So for patients who have weakened abdominal wall tissues or weakened abdominal muscles, tend to have what we call abdominal diastasis. The next is abdominal shape post-pregnancy. For mothers who have weak abdominal wall or weak abdominal muscles, may get what we call abdominal diastasis when the pregnancy is completed. They often lead to a rounded or protruded abdominal wall, which cannot be reduced with weight loss or dieting. Breast is often affected in the same way as well. When the breasts expand and shrink during pregnancy and after breastfeeding, it often leads to loose skin, stretch marks, breast atrophy, leading to droopy, flattened breasts. Okay, there are other physical changes that you may notice during pregnancy. For example, skin's oil production usually increase during pregnancy, and that may lead to acne formation, enlargement of your pores, eczema, and so on and so forth. So patients often may find that their complexion worsen during pregnancy, their nose may appear bigger, their skin become more sensitive, redder, and such. There's often increased risk of varicose veins as well, especially because of the pressure of the womb exerting on the venous return from your legs. So mothers usually have to be a bit careful or be advised for that. And about 5 to 7% of ladies may develop accessory breast tissue during pregnancy. That may lead to pain, discomfort, discharge from those swelling from the armpits mainly. So we have patients, mothers, who have come to see me for various complaints, like I mentioned earlier, on the issues that they face during and after pregnancy. And they often come with complaints such as that they have tried very hard in exercising, in changing their lifestyle, dieting, be healthy, so on and so forth, to try to get back to their pre-pregnancy shape and condition, or even try to improve on the complications, issues that they developed during pregnancy. But however, they couldn't achieve what they want, and they will come in and tell us that, is there any options for us to help them? So just for example, I've got a patient that we have delivered like 6 months after that, and they find that she had loose skin, stretch marks, excess fat around the abdomen, the waist, even the arms. And despite her being very, very active in controlling the diet, lifestyle, exercise, and so on and so forth, she still couldn't get back to what she had before pregnancy. And so our solution is to see what we can do in terms of shaping and then removing it and recontouring her body with liposuction. And there another patient that I remember telling us that after breastfeeding, she suffered from breast atrophy, loose skin, saggy breast, and she hates it and want to explore about ways where we can improve and lift up her breast volume again. So the options that we have for them is often to say that we can do what we call autologous fat transfer, where we remove fat from unwanted areas such as the tummy or arms and graft them into the breast to reinflate the volume, to make them look a little bit more lifted, projected, and not saggy or loose. For patients who suffer from oily skin, acne, and large pores, the treatment is often medication, creams, and even lasers, skin lasers to improve that.
Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.